Hi everyone. I'm not sure if everyone's on mute at the moment, but welcome to the Sustainability Planning webinar today. So I'll just start with a acknowledgement of countries. So we'd like to acknowledge that all organisations participating in the Lighthouse Hospital project are spread across many traditional lands. We pay respect to all traditional owners of these lands and those who under custodial law nurture and protect country, and we pay respect to elders past, present and emerging. So once again, thank you for your attendance today. I'd like to introduce Richie Feder from Spark Strategy, who will be our trainer today and who will be taking us through the sustainability plan. So please feel free to ask any questions throughout, and there'll also be opportunity at the end. So I'll hand it over to you, Richie.
Cool. Thank you, Anthea. And thanks everyone for inviting me along to present and talk about sustainability planning. As you'll see in the screen in front of you, throughout the webinar, I'll be sharing a couple of screens. It's the most pragmatic way to talk through the focus of the day, a bit of context, and then talk through the kind of template that we've produced to help you pull together your sustainability plans. Importantly, I just wanted to first start with the bit of what the focus of today is over the next hour and a bit of context of why this is so important and following up from the great work that you've done within the Lighthouse project. Here's where the magic in. Oh, pardon me, sorry, I'm pressing buttons on the wrong screen. How do I get that to?
Whenever you go down there. Oh, what is that red dot?
I apologise for this start, which is technical glitches.
It's always the way.
I've done something with this red dot. Here we go. There we go. Apologies. If you were in the room, you'd just be watching some bloke press a lot of buttons at the same time. So today's session has got three kind of key focuses. One, making sure that everyone has a clear understanding of the context and purpose behind sustainability planning, that everyone has a chance to look at the structure of the sustainability plan template, and as well as provide some practical examples of how you can complete it to ensure that everyone feels comfortable and confident in doing so, and that we have an element of consistency across the whole piece. Like all of these things, it's a work in progress, but we recognise that we really want to give you the opportunity together to ask any questions about how we go about it. And lastly, that we understand the responsibilities and timeframes behind completing the plans itself. So why is it important, fundamentally? The work that you've done over the last 18 months and by the end of the project 2 years is being intensive relationship management within the hospital, really investing in how you can support Aboriginal and Torres Strait Islanders get the engagement and the support that they require within the hospital system and context. Sustainability planning gives us the opportunity to provide clarity and continuity post the completion of any project. Many organisations in the social sector have this continued problem of great funding to invest in really impactful pilots, but sometimes limited by the time frame that that funding creates. So looking ahead, how do we ensure that we understood what's happened and how we can continue that good work in the context of each hospital? The idea behind the sustainability planning that we're going to taking is to set out clear operational understanding of the operational and the potential investment needed to continue to support that key activity. We do recognise when we talk about investment, there are a number of discretionary decisions being made within the hospital. However, it's important that we do highlight the effort that's gone into creating the processes and the various different groups and other relationship management undertakings, so the hospital and those that are decision makers effectively understand. And then lastly, it's about being clear on that evidence base for that continued change and implementation. Within all of the actions that you've done, it's to help support the national requirements and standards that want to be met. A lot of the actions are tied directly into that. So in the sustainability planning, we not only think about the actions, but how they tie to those different outcomes that you've been pursuing. I'm just going to check, make sure that there are any questions. Cool. And then,
Just mute
all right, just in case there is a bit of feedback during the conversation, I'd be really grateful if everyone's happy to go on mute. If you have any questions, there's a couple of ways that we can do that. Either you can type in the chat box, ask us a question, or during the course of the conversation, I'm very happy if you want to interrupt me, and I'll do my best to stop my flow of conversation and answer your question as well. Last bit is about context for the Lighthouse project. Obviously, in coming in, I've had the chance to learn a lot about what you've been doing. You know it better than anyone through all the involvement over the last 18 months in working in your hospitals. But as you're very well aware of, the project funding draws to an end in June 2019. And actually, I think it shows maturity of the project that we are looking 6 months out to that to really ensure that we've got effective succession around the activity and decisions being made about any potential resourcing that may continue to be in place, again, based on the discretion of the different stakeholders involved. Actions being put in place, it's not ideological or cheesy to say that they are changing lives and positively impacting the experience and the engagement of Aboriginal and Torres Strait Islander peoples. And in investing in this type of activity, the whole point is to prove how these are making impact. So we want to make sure it continues. And then lastly, it's all very well having a focused project activity where through the course of the last 18 months, and by the end of the project, you have engaged with a range of stakeholders, but sometimes out of sight, out of mind. And I think it's really important that hospitals do have an understanding of what is required to continue to support those activities and they feel informed. I appreciate some of that has an element of repetitiveness. I think it's very easy to come from the side of those heavily involved in the project to understand their implications. What we're doing in this type of structure in the very first instance is setting clear expectations, is setting clear understanding about how your actions could drive really effective outcomes. And it's also starting to line up and influence stakeholders in any potential decision making going forward to ensure that they continue to uphold the standards that have been put in place. I wanted to give that brief bit of context just to kind of almost less about motivation, but being really clear that there is a clear link to the completion of the template and the structure through to an outcome to support the project going beyond June 2019. So it's not just a form, it is something that's going to really help us in looking ahead. I'll pause for just 2 seconds. Are there any questions from anyone in the group? Otherwise, I will continue through to the practical part of this webinar. No, I'll take that as a no. And obviously, those that are listening to it on recording, please don't unmute yourself and start trying to talk to me. That will have much less limited impact. I have no doubt through Anthea we'll send through details to answer any kind of questions that follow up in that regard. Just going to change my screen here. So what you'll see in front of you, everyone, is the template that you will be... Oh, no, you won't see that because I haven't changed it. Pardon me. I am the epitome of a Mac user and I've been put in front of a PC. Okay, everyone, you should now see on the shared screen a version of the template that you will be receiving, and that will be sent through by Anthea, if not already, already been sent through. Yeah. Great. So what I wanted to do over the next 30 minutes or so is break down each part of the template, being really clear about what we're asking for and the structure in which the information can be captured. As we go through this, I'm very happy to take any potential questions that you may have. And so please feel free to stop me as we go. So as you see, the structure of the template is designed to be simple in terms of the information that we captured, but we do recognise that we wanted to bring some examples to bring it to life. Section 1 is relatively self-explanatory. Essentially, it's capturing the core information to make sure we've got the context of the project that you're working on, the hospital, who you are and the key executive sponsor dates, and the project start and finish dates. I don't have enough knowledge to say whether they have varied within the hospital. I imagine there may have been some form of staggering. So it's just about capturing those key dates so we recognise when the project has been operating. And it's really that kind of hygiene information that enables us to make sure that we've kind of contextually got the template right. So I won't dwell on that too much further. I don't need to give you an example of how you capture your own names. The core of the structure of the sustainability plan is really focused about the actions that have been undertaken in the course of the project. Over the last 18 months, you've been working extensively across a number of different domains and areas of focus to support hospital policy, practice and activity, as well as the relationships that go around that. And what we want to do is we want to recognise each of those domains independently and the importance of the actions that have underpinned it. So each of the tables have the same structure, but they focus on each domain outlined within the kind of scope and focus of the project areas. So I'll just quickly talk through the structure. So in front of you, you'll see domain number 1, governance. And I'll just quickly explain the 4 columns of the table before we kind of get into some of the detail of the example. The first column is around the action undertaken to support that respective domain. And when we talk about an action, what we really mean very clear about here is the activity you've undertaken to deliver an outcome. So it's about the establishment of a process, it's the establishment of a group, it might be the establishment of a form of best practice or a training course, but it's been really clear about what that action has resulted, the activity has resulted in that direct action. The second column is around purpose. Where we've tried to narrow this down to make it much simpler and aligned is we've tried to map that purpose to the National Safety and Quality Hospital Standards, of which, if you don't already have a link, Anthea will follow up with the link to those National Safety and Quality Hospital Standards, which I'm sure many of you are very familiar with anyway. And we want to show that as one of those key criteria for the pilot and the project in itself is to deliver against those standards and identify those actions within each of those hospitals which will best suit that and meet it. So that purpose is really important for us, and it's also important for the hospital to understand how that activity or action may deliver against that purpose. The third column is the resource, and this one can sometimes be a little bit confusing because there is sometimes grey space into what extent the resource can be used. This is about the resource required to continue the delivery of that action. So in some cases, that resource is currently yourselves. So it's about identifying within the hospital system, to the best of your ability, the resource that would be required to continue that particular action or activity. So just to clarify, that is the resource required to undertake that action. Where it is currently yourself, it's recognising post-June 2019, whether that would transfer to another particular role within the hospital. And we'll go through some examples where that is a bit less defined, and that's okay, but it's about recognising sometimes the capabilities or skill sets that might deliver that. And then lastly, the timing is not always a set date. Often it may be a frequency. And the importance of that is to recognise whether it's a one-off time piece or whether it's something that continues at a regular frequency or is in perpetuity, but which would be, it's based on a particular need or a particular demand or a particular question coming from someone else within the hospital. So there are 4 kind of key areas: action, something that's resulted from an activity that's been undertaken. And just to be really clear, these are things that are already in place. The purpose, how does it align to the National Safety and Quality Hospital Standard? The resource required to continue that action. And the timing essentially is the frequency or a set date in which the action needs to be followed through. With that being our structure, there's an element of how this is repeated across all 4 domains. But what I wanted to do now, to bring it to life and to provide a clear example looking at the screen in front of you, is share with you at least one example in each of these areas to give you a bit of a sense of the level of detail that we're looking for at this stage. And obviously, just to be clear, what underpins this, I've no doubt will be a lot more information, but it's to be able to capture enough to articulate and conceptualize the amount of activity happening and those key actions that you wish to continue. So within each of these domains, I have no doubt, and I look to your colleagues around me to the extent that you understand each of those areas. So I don't want to kind of repeat everything, but I'll just read through the kind of base description just as a clarification to make sure that it's fully aligned. And I pulled this from the scope work of the project itself. I may have paraphrased it just to put it into a neat line. And essentially, domain 1 governance is around hospitals demonstrate executive leadership and accountability, develop effective relationships and partnerships with Aboriginal and Torres Strait Islander organisations and the community through consultation. So to many of you, that is effectively around how the organisation are ensuring that they are accountable to hold strong relationships and partnerships within that. And that does range across both actions in terms of process to oversee the things that happen, as well as the creation of bodies or advisory groups and other committees that support the governance and decision making within the hospital. And the example that we pulled out is around the creation of an Aboriginal and Torres Strait Islander advisory committee created as of June 2017. So as you see there, the action here is the advisory committee has been established, and we provided the date to give a little bit of context behind that action. So right now, this is a group that has been operating for the last 18 months, in essence. The purpose of that group is aligned to the National Safety and Quality Hospital Standard 1.2, which is to ensure Aboriginal and Torres Strait Islanders' health needs and agreed priorities are met and aligns with the relevant different standards. I won't repeat all of these every time, just to give you a bit of flavour. The resource required to do that, when thinking about what takes to run that advisory committee, we've made an estimate and we've identified that actually the advisory group's key resource is around a secretariat to ensure the continued logistics and operations that group can meet, to support in the development of agendas and various different issues that advisory group may discuss within the hospital context. In this case, we've estimated a time of 3 hours per month. In reality, you will know from your own experience in the development of these committees how much time approximately you are providing towards this. We use a month as an estimator for the hospital. We use the type of nature of the role, recognising that could fit within a number of roles within the hospital, but it's actually the kind of skill set that supports that. And the timing, in this case, we've assumed that there is a quarterly timeframe. This is a hypothetical example, but it may very much relate to something that you're experiencing yourself within your hospital. I'll move on to the next area if we haven't got any questions around that. The next domain is around cultural competence. So this is where hospitals continue to achieve cultural competency through building capacity for culturally appropriate patient-centred care, providing relevant and appropriate resources, and creating an environment that is acceptable and meaningful to Aboriginal and Torres Strait Islander peoples. In essence, culture plays out in many different ways within the hospital setting, but it's ensuring that people understand the consequences and put in place practice, behaviours, attitude, and create an environment that is welcoming to Aboriginal and Torres Strait Islander people, much of which has been done through your own consultation and discussion within the communities that you work, because that will vary. And we recognise that this is a really important area, and we want to capture the actions that talk to how your hospital has implemented and driven effective culture to support this type of activity. So the example we provide is around creating that space. So it's the maintenance and ongoing refreshment of cultural spaces, family rooms across the hospital put in place by the Lighthouse project. So in this hypothetical example, it is about those physical spaces created to support Aboriginal and Torres Strait Islander peoples accessing the hospital that may include, cultural recognition of their art, might have a whole different range of things that are suitable for their community. Purpose, as you can see, aligns to the National Safety Quality Standard 1.33, and the resource is essentially the hospital facilities management. It's a point of contact to ensure that those spaces are effectively maintained, respectfully updated where appropriate, and ensure that they are protected and ring-fenced and used where required, if they have been established within the hospital. The timing is ongoing, as essentially the creation of space and the maintenance space will be supported by need. And that contact point will be the one that, going forward, if it's not you, or it might already be supported by a management or facilities person within the hospital, that will continue on post-June 2019. I will look around me to the rest of the room. If there's anything you would feel free to add, please do.
Any questions?
I'll double check. Yeah. So with those that have joined us in the group so far, is everyone feeling comfortable with the approach that we're taking? Or any questions around the structure? Even the pace. We can have a thumbs up or a confirmation from anyone. One person will be fine.
Thanks, Holly.
Thank you. Perfect. Perfect. We had a volunteer for those. Thumbs up. Yeah, awesome. Thank you. Well, in that case, I'll continue. And then what we'll do maybe is, as we go through this, if anyone would be happy to share a potential example that they have or feel comfortable sharing, that would be great, just to kind of help bring it to life. The third domain is around workforce. Oh, hold on one second. The third domain is around workforce. I'll answer the question in a second. It's around how hospitals continue to develop and maintain a culturally and clinically competent workforce that continuously and effectively uses the skills and knowledge of Aboriginal and Torres Strait Islander staff across the hospital, especially within multidisciplinary teams. As you can imagine, this feeds into cultural awareness. It feeds into the capabilities and capacity for everyone in the hospital to recognise some of those additional supports required, and is really centred commonly around that education, knowledge sharing of best practice, as well as practical training that many people that you have supported in the hospital have undertaken over the last 18 months. So, and one of those fundamental things is the role of project officers and support workers themselves. So the example here is around where the hospital need to make a decision on their commitment to continue funding around Aboriginal liaison or Aboriginal health worker positions established within the Lighthouse project itself. And this action, as you can see, is around a defined decision, and it's a really important one when thinking about the future and the sustainability of the program. And I think in this case, it demonstrates an example where we shouldn't be afraid to capture those actions which highlight the creation of an activity and also highlight the need to make decisions around whether that activities continue in the first place, not just the continuation of them themselves. The resourcing to do that will be around the executive and other coordinators and workforce decision makers, and the timing we provisionally talked about actually, will there be a funding decision before June 2019? I did have a question, which I'm just going to read out from Danielle, and it was, can I clarify how many action initiatives under each domain, as I have a lot of LHP initiatives on my action plan? Danielle, that's a really good question. There isn't, design behind this, there isn't a rule of thumb per se. I think it's about recognising, in terms of key sustainabilities, those actions that are there to help engage and influence the hospital around what needs to be continued going forward. So you'll see in the structure that we have later on is there might be a number of action plans that have yet to be implemented that are still, important. In this case, for each of these domains, we want you to reflect on all of those actions that you believe will help maintain and support the standards that have been developed within the hospital. So apologies, I can't give you a defined number because I wouldn't want to limit you. I wouldn't want to say 5 while not having the maturity recognised over the last 18 months, a significant amount of activity has happened. What you may be able to do, if there are a large number, is to roll them up into key action outcomes that can be consolidated into a certain nature of a resource or a certain kind of set decision around that.
Can I ask a question? So should this, the way the template's been set up, capture at the activity level rather than the sub-activity level of the activities in the activity plan? Because that might also reduce the number as well. If there's multiple sub-activities under one activity, we're capturing it at the activity level. Is that the intention?
In principle, yes. with questions like that, the challenge of it is to what extent people articulate activity and sub-activity. I think the way that I would personally reflect on it is the extent to which a decision needs to be made around the continuation of that activity. So, for example, I'll use the first one I use because it's the simplest. Let's talk about the advisory committee. We know that the activity is the establishment of that advisory committee and the continuation of that group meeting. Within that will be a series of sub-activities, which is the creation of agendas, the nomination and selection of members, the management and organisation of dates. They're all critical activities that require resourcing to support them. However, for the practical nature of the sustainability plan, the core action is that committee group itself. So that's an example. I appreciate there will be a number of probably more complex examples. I've cheated and used one of the easier ones. And I think it's a bit of a logic test, and it's a bit of a gut feel in some of these cases.
Yeah, and the test is, would you agree that you're really asking, can I walk away from this project and leave it in the hands of others? I'm passing over the reins, so I've got to make sure that everything I've worked for is not going to fall apart. So there is a judgment there that needs to be made. Yeah.
Great. I've had another couple of questions, but I might leave that till the end, which is around future funding and opportunities to support the work that's been going on, which is a great question. It's the kind of question that I love through my work in the social sector and thinking about sustainability more generally. But just before we go there, I just wanted to finish talking around the structure of the template and give a few more examples in the other domains to make sure that it's complete. So the fourth domain is around care pathways, which is hospitals continue to improve access to and uptake of evidence-based, I've forgotten what ACS care, acute coronary secondary care for Aboriginal and Torres Strait Islanders peoples. So within this really is looking at some of those pragmatic policies and activities being developed within hospital to ensure that the appropriate care is being provided. And we've got a couple of different actions here because of examples here to talk through. So the first, which will be a very commonplace one, I've no doubt, will be the maintenance update and implementation of key processes developed in the course of the Lighthouse project. And the examples that we've identified here are the CCU discharge against medical advice and the de-escalation checklist, the Aboriginal Medical Services GP referrals within 7 days post-discharge. When thinking about the whole range of key processes, as you can see, we've grouped these together. There may be occasions where there are different thematics around those processes that you wish to group together because they may have different resource implications to them or different levels of complexity and updating to support them going forward. And you'll be far more knowledgeable about that than I. These are really important actions to capture because I think the hospital and areas that you're working with to know some of those kind of key policies and process areas that you've touched on and you've influenced within the work over that period of time. And it's calling out and clearly recognising how those policies and processes may need to be adjusted, updated and refreshed as appropriate in the absence of you potentially not being there and someone else being responsible for that. So it's a great place in which to do that around this domain. The areas responsible will be looking at clinical and quality assessment type staff, and it may really vary depending on the wards that you're working on, depending on the kind of operational structure within the hospitals. And we all know across the country, across states, there are vastly different approaches and ways of doing this. And again, the time frame in this one is around ongoing, as those processes will be updated as required. And it may be the case that to create that kind of impetus, it might be something that you actually put in place for an annual or biannual check as a kind of a reference point, the fact that you shouldn't wait for something to change to refer to these policies. These should be something that are actively used to ensure that they're being upheld and supported within the hospital. The second example is around ensure continued application of process to correctly identify Aboriginal and Torres Strait Islander origin. In talking through this example, this is actually a very critical one that I'm sure many of you have talked about within your own settings, which is ensuring that people are effectively, respectfully and correctly identified when they are admitted if not before, the appropriate process, point of contact within the hospital to ensure that the relevant processes and actions and information is applied to all those being involved in the hospital. This is something that wherever new services are offered, new activities are offered, new forms of intake are offered, that this type of check has to be ensured. And I think it'd be a really important action to make sure that the hospital recognise it as part of their own process in creating those type of intake and other types of activity. So again, the resource is likely to fall to hospital clinical and quality assessment staff or other staff responsible for these types of processes, and it would be something that's ongoing or defined by those different intakes. So they're the 4 examples. I'm just going to check. I saw I had a couple of questions. Just make sure whether they've come through. Let me think. So the question around, will a copy of the presentation be made available after this meeting? Yes, it will, in short. This example template will be sent to you, the one-page slide, and then the webinar has been recorded. So if you're really excited, you are very welcome to listen to it as many times as you'd like. Yeah, please.
So I have a question about the resources that you've captured under the 4 domains. So it talks about the roles. Would this be an opportunity to also capture whether there's other resources required, potentially financial as well, or are we looking just at the people responsible?
It's a really good question. The reason when in developing this template, the reason I focused on roles is there's an element when you look at resources, how long's a piece of string? And it's not a clear answer, but what I'm saying is ultimately there's multiple ways you can deliver that action. In planning within many of these types of organisation, people resource is and expertise and knowledge and time to undertake these actions is commonly the key practice. And it's reflected by the funding has supported project officers to enable these actions. So in reflecting on that and reflecting on the template, people resource was the main area of focus. Ideally, if you can identify that role and you can identify the time component, that will be incredibly valuable. And you will see through a number of these examples, we have highlighted that. So let's take, for example, the maintenance and update of those key policy processes. If you do say that that's an annual review process, if you can say, well, actually, there are 20 processes, actually a formal clinical review of those may take a couple of days of time. You might then be able to estimate that this is, 20 to 30 days of a multitude number of people across the period of a year. That's ideal, and behind that time is an associated cost. That would be my advice to you at this point, because the financial element, unless there is an actual infrastructure or asset investment, then yes, that's fair enough.
So a lot of the activities that hospitals are undertaking are sort of process and system changes. So, they're not necessarily cost associated, or it would be, a little bit challenging potentially to drill down to that. But I think for the infrastructure type resources, things like that, where there might need to be reprinting or, uniforms purchased, things like that. I don't know. Do you think it's worth, even if it's just an annual, budget required, just noting it, that it needs to be considered or not?
I think there's nothing to say or not. I guess this is where you get the question around consistency. Maybe the best thing to do in the sake of this template, and I'll take this on advice at this point, is identify and flag that the risk of putting in numbers can actually be a bit alienating, would be my opinion at this point, at this element and juncture in which you're planning this period of time.
I don't think we need to put numbers in at this stage, but it might be flagging it, just saying, this is something budget required, because the next financial year's budgets are being developed. These are the kind of things that probably...
I think that's a really good idea. I agree.
Okay.
Yeah. So in that case, just to clarify, where in that action there is an investment in a product or a piece of infrastructure or a key asset, I think it's important to flag in an additional bullet point that investment would be required for a particular asset. Yeah. I think it's a very good point. So moving on, before I move on, are there any questions around just the kind of current actions and each of the columns that we've talked about that we haven't had already. No? Fantastic. Okay. As I said, there'll be plenty of chance if you wanted to ask a question later, otherwise, or post the completion of this webinar. The third part of the form is talking about future outstanding actions. Some of these which will be captured before the completion of the project funding, and we're kind of using it as an opportunity to really highlight those and identify that this is a kind of key activity going through to the end, as well as those important things that you believe will go beyond the funding period of time, from where you sit today. And we've given a few different examples to kind of capture around that. The columns you'll see are essentially the same, except the titles have changed to focus on the outstanding action, to be really clear that this action hasn't yet been undertaken or yet to be completed. The purpose, again, we really believe that it's worth keeping consistent in the alignment to the National Safety and Quality Health Standards. The required resources are capture of people at this point, but I think the point is relevant from the last conversation, which is around that if there is a potential asset or infrastructure investment, it's worth highlighting. And the timing is ideally when will that action be completed by, at what points that potential decision will need to be made. I've just had a question before we talk from Holly around actions and sub-actions. We did mention this briefly earlier, and the way that we defined the difference between action and sub-actions is the focus should be on the kind of high level, the kind of top action, which drives and informs the hospital of what needs to be continued holistically going forward to enable that area. Recognising if there are the caveat to that, and I think this is about an element of your own gut feel and intuitiveness. If there is a sub-action that has a very defined amount of resource to support it, then I do believe you should highlight it. Because like anything, it's not just saying what you've done, what it's for, but the sustainability part here is getting the hospital and those peers that you're working with to recognise the investment into the continuation of that work. So I hope that answered your question, Holly. So this third section is around outstanding actions. So the table below has the same structure, but it's to capture what will be done. The examples that we provided, I'll just quickly walk through. The first one was around cultural champions to be identified, trained and supported within the hospital to enable continued process and actions following the completion of the Lighthouse project. In thinking about this type of action, whether this is relevant or not, it's an example of how actually the work that has been done can be supported way beyond the boundaries of yourselves as project officers and those peers that you've been directly working with. It's essentially embedding some of that culture into the hospital and getting them to take ownership and accountability for it. As an example, how that supports a range of different standards, and the required resources are about what would it take to get those cultural champions on the ground, and the likelihood in this case would be, for example, using our own hypotheticals, the advisory committee and the project officer may identify those cultural champions in the lead up to June 2019, and then there would be an investment to support their ongoing work beyond that. The next one is around the creation of a calendar of cultural competence training going forward. And this was specifically targeted at those who've done training already. The reason why it's an outstanding action is you may create the calendar to highlight that this is being done. And then beyond the funding period, the execution of that calendar will be something that needs to be supported going forward. And the calendar idea and the way of framing in that is recognition that what is the kind of key activity, training activities that could be continued beyond the end of that funding period, and the type and nature of that training. It doesn't go into the detail of all of the creation of that training in this case. It's the recognition that the hospital may have that autonomy in what that training would be, but there is an ongoing support and professional development that underpins it. And last example that we have here is around finding opportunities for improvements to be monitored through hospital government groups, such as standing agenda items. So this is a practice that is embedded into a number of the activities or committees or groups that you have created. So providing in terms of an outstanding action, it's saying how within the hospital structure, within the governance structures, can you insert and influence an agenda item that gets them to continually think about Aboriginal and Torres Strait Islander peoples and their care within the hospital around their cardiac needs. So in essence, that is the structure of the document. So just to very quickly rerun through, section 1 is hygiene. Sorry, I'm flicking very fast. Section 1 is hygiene, very simply to ensure that we know who's completed the template. It sounds ridiculously obvious, but it's really important just to make sure that we have that information up front. Section 2 is around actions that have completed in the course of the project to date, to enable us to pull together all this thinking and for you to start to share and influence and engage with your peers within the hospital around how these could be continued post the end of the project funding. And then lastly, section 3 is about outstanding actions. So those things that you seek to complete prior to the end of the funding period or that would require completion after the end of the funding period, but actually fully aligned to supporting and delivering against the standards that you've been operating to that whole period of time. I hope this has been helpful in using those examples to go through. I'd like to take the opportunity now to see if there are any other questions around the template and what's required of you. Fantastic. So in that case, I might, if you guys are happy.
Actually, there's one under Holly.
Oh, sorry. Oh, that was a confirmation. Here we go. We got a question from Lisa. Oh, sorry, my apologies, Lila. Is there any procedure available to inform the roles and responsibility of cultural champions? Can nurses or doctors be champions? I will pass over to my peers and colleagues. Obviously, this was an example project, but I think it's actually a really good question and something that could be used to really drive sustainability. I'll ask those coordinators. Do you have a view on this?
Most definitely, yes. Yeah. I think it's important perhaps to, if you want to identify champions, what you've got to do is define what you mean and write out the role and the responsibilities for you, for your champions. And it's really someone meeting that description, and it can be anybody. And as Anthea said, clinical staff are well placed to be champions within your hospital. So as are a lot of other members of the hospital as well. So they're not the only ones, but they're certainly well placed.
Fantastic. Were there any other questions anyone would like to pose around the template or any of the examples that we've given today? Great. Well, one of the ways that actually is a really nice question from Holly to kind of add around the sustainability planning perspective, which is what advice would I give, re-knocking on the door of private sector or philanthropy in order to continue your work? I think that's a great question, and this is the question that underpins much of those working in the social sector and supporting service delivery and other programs and projects and pilots to kind of create positive and impactful change, which is how do we think longer term sustainability around the funding and the nature of the work that you do. I don't have a strong understanding about the practice and the approach being taken place by the Heart Foundation and your partners to think about that more broadly, sustainability. My commentary would be more from my own experience, and the way that many organisations are really focusing and thinking about this is, I suppose, essentially three pathways. First pathway is how can you continue meaningful actions within the community and absorb it into the community itself. So in this case, it's how does the hospital allocate existing resources to enable and support continued action going forward. The biggest challenge to that one is the evolution of those actions and the leadership to drive those actions in a way that will continue that community engagement and then recognise alternative and new things that need to be put in place to support Aboriginal Torres Strait Islanders. I think it's really important culturally. I think it's fantastic outcome if the hospitals recognise the impact of the work done and see and take accountability for the continuation of that work in the first place. And we see that across a number of different community settings around community ownership to see and ensure that those changes continue. So that's almost pathway one. And it's an element of status quo, but it doesn't necessarily provide the weight behind what many of you project officers are doing. The second pathway is around, essentially, the crudest way to put it would be commercialization. So it's recognizing how there is a business model that underpins the delivery of that action. So, for example, and I'm saying this without any evidence base, for example, it's how those hospitals participating in the pilot or other hospitals that would be interested in participating in such a program would pool their funding to fund the continuation of this project, either individually or collectively. And that model would be about essentially a charge for the delivery of this expertise that happens and the coordination of it. And that is happening in a number of different spaces. There is everything through social enterprise all the way through to essentially professional service models, for want of a better term, that underpin the creation of this policy and practice. And it goes beyond just funding that actual resource. I think this project is about the collective sharing across those 18 hospitals. It is about the coordinated response and support of the Heart Foundation in partnership with the hospitals that makes it effective. So you'd be looking at those types of models. The third option, and the most traditional one, is looking at, philanthropy and grants-based approaches. And that is a very viable and pragmatic option based around essentially genuinely demonstrating evidence for the impact that you've created, which actually can be complex. There is lots of, no doubt, qualitative evidence around the stories being created. The challenge with many of these things is how do you then articulate the blend of those impactful and incredible stories of people that have been involved through to the kind of quantitative evidence that demonstrates that this is the best way to invest in creating a better outcome. So it may cost $1 million to run the program, and it's not as simple as that. Social return on investment, but it's in spending $1 million, we're actually realizing greater, social and financial impacts, both in terms of reducing, missed appointments, reducing, and increasing awareness in care so that they don't have repeat issues in their, post-cardiac incident or such. And things like that, and being able to evidence that and target that, through to, do we localize it? Do you actually blend that with, engaging with state and local or hospital territories all the way through to federal? The wonderful job that you have is trying to navigate the incredibly complex state-based and health-funded system that you have, which is no doubt one of the best in the world, but it's coming from England when you've got the NHS, good or bad, it's just one crazy machine. In Australia, you have about 50 of them. So I don't know how well that answers your question, Holly, but those three channels are the things that are worth exploring. And I think there are a multitude of decisions about how you invest in resource to look at that. And one of those outstanding actions may be for the hospital to identify funding sources to support areas such as cultural champions or areas such as particular Aboriginal medical service staff and health workers that might be highlighted. So, yes, just checking any questions.
Just one, just adding to what Adam was saying, Richie,
It's okay, no problem.
was saying, one way of influencing their future is to have responsibilities written into people's PDs. So that's something that you can think about too when you're actually thinking about sustainability and responsibility of the required resource.
Great. Yeah, thank you. Yeah, that's absolutely right. And I just want to share an example from Danielle, which has, for ongoing activities, she has started asking the question for project initiatives to be factored into Aboriginal health unit budgets, ongoing cost centre, or have started requesting for the initiative whether it could be part of Quality Unit 6 monthly audit schedule. I think that's a great idea. I think the Sustainability Action Plan is a great way to capture that, but it should not be the only method in which you are starting to embed and influence this kind of stuff. And I think that's a really smart way of working. You actually ingrain it into hospital practice and process itself is fantastic. Lila has just begun a drive looking for champions, so fantastic. So our hypothetical example has touched on something there, which is great. And I think that's everything from everyone. The time is 2:50. If there are any other questions, please call out now. Otherwise, I will confirm, what's the timeline for the sustainability planning completion?
So it's due on the 20th of December.
Fantastic.
So it's got sort of 3 weeks. Yeah.
Great.
Which is kind of scary because that means that Christmas is not too far away.
But kind of great at the same time because
Yeah.
we've got Christmas not too far away.
Exactly.
Great. So just to clarify, that's 20th of December, and I've no doubt you can talk to each of your respective coordinators that'll be able to support you through this process. And I say it now, not just in running the webinar and helping with the template. I'm very happy to answer any questions or provide any advice about how you start to bring this together into a narrative, of course, as part of this. Great.
Fantastic.
Okay, thank you.
Well, thank you very much, everyone. I hope you have a lovely afternoon. And for those listening after the session, please don't hesitate to get in touch. Thank you.
Thank you.
Thank you.
Thank you.